Today we are going to talk about sex-related bleeding risk in acute coronary syndrome patients receiving dual antiplatelet therapy with aspirin and P2Y12 inhibitor. The study aimed to determine sex differences in major bleeding in relation to dual antiplatelet therapy after percutaneous coronary intervention for acute coronary syndrome. The Collective Cardiology Research Registry was designed to evaluate the application and outcomes of dual antiplatelet therapy after acute coronary syndrome or percutaneous coronary intervention in the Netherlands. Overall, 1,172 women and 3,087 men with ACS or PCI were enrolled between August 2011 and June 2013. Based on a tailored regional dual antiplatelet therapy guideline aiming at bleeding risk minimization, 52.6% women and 66.9% men received prasugrel as first choice P2Y12 inhibitor additional to aspirin. Women more frequently had contraindications for the use of prasugrel than men. Femoral access was more common in women than in men. Women had higher incidence of TIMI major bleeding at 1 year than men. After adjustment for established bleeding risk factors, female sex was associated with over twofold higher risk of TIMI major bleeding than men. This difference was already apparent at discharge and appeared to be caused by access site bleedings. No sex differences were found in non-access site-related TIMI major bleeding up to 1 year. To conclude, women with acute coronary syndrome or percutaneous coronary intervention receiving dual antiplatelet therapy had higher TIMI major bleeding risk caused by an excess in access site bleeds, mainly in relation to the femoral approach.